Welcome to the Morningstar Series 3 Stock Picks. I'm Holly Black. With me is Paul Major. He's co-manager of the BB Healthcare Trust. Hello.
Hi.
So you've got 3 healthcare stock picks for us. Where would you like to start?
Okay, well, let's start with Illumina. So all 3 of these stocks are really around the changing healthcare paradigm. So Illumina, the best way to think about Illumina is it's the Microsoft Windows of the genetic age. So we're going to see genetic information used more and more to understand diseases, understand your risk of disease, and understand how best to treat somebody. And although there are hundreds of diagnostic companies developing thousands of different tests for all sorts of different diseases, generally speaking, the vast majority of these things actually run on an Illumina machine in the background, and it's their technology that drives the analysis of all that information. So as the price of gene sequencing goes down, you see it used more and more frequently, and that means Illumina will sell more and more machines, and it's a marketplace that is going to grow sort of 15-20% a year for the foreseeable future. They have a 90% market share of gene sequencing.
And I'm guessing one of the real benefits of this kind of company is it's quite a sticky customer base. You know, a whole hospital or the entire NHS, it's not going to move its system when it's got one that it trusts.
Well, yeah, which is why the software analogy in many ways is perfect, right? You know, there are lots of IT people probably say Windows is not the best computer operating system, but it's so ubiquitous that it becomes the gold standard. And you're absolutely right, that's what's happened with Illumina. They managed to simplify the technology and make it reliable and cheap before anybody else did, and in so doing they've created a whole ecosystem around them. So there's all these other companies creating the demand for the tests and then buying their machines to facilitate doing that and all that sort of thing. So yeah, it becomes a sort of closed ecosystem built around their technology.
Okay. What's stock number 2?
Stock number 2 is a company called Anthem. So if you accept that the healthcare system is going to change, an obvious question is who benefits in the first instance from those changes, and the simple answer to that is the person that pays the bill. And in the US, generally speaking, that will be an insurance company, either managing government business or managing private, employer-based insurance. Now, Anthem is a funny company. It's sort of an agglomeration of lots of other companies that wasn't very well run for a long period of time. Got a new management team in there. It had a bunch of contracts that were very onerous, that meant it was operating one hand tied behind its back. Is now free of those contracts, so has the opportunity to reprice its book of business and gain significant amounts of market share. Insurance is also very cheap because of all the political overhang that's been going on in the US around the election, this Medicare for all debate, which we're very relaxed about. So insurance stocks generally look cheap, and Anthem looks particularly well placed within that group moving forward over the next couple of years.
Yeah, that's interesting, because I think of insurance as more of a stock for a financials fund, not a healthcare one.
Well, healthcare insurance is all about basically managing risk, managing healthcare risk. So understanding who you've got in your book of business, what their risk profile might be, and helping them avoid getting sick in the first place. You know, we all understand the relationship between diet and obesity and exercise and all those sorts of things. So there's lots of simple things you can do actually to reduce people's risk of disease while they're being looked after by you. In doing that, you reduce your costs, and in doing that, you obviously increase your profits.
Yeah, makes sense. Okay, what's our final stock?
So the final stock, kind of a related theme, is a company called Teladoc, which is a telemedicine company, but it's also the leader in something called, well, 2 things, called electronic triage and case management. So if you talk to any big health system in any country, even the NHS, if you look at their 10-year plan they published recently, it's all about the idea of what we call digital first. So when you first go to the doctor, you create kind of a digital footprint that follows you through the system and enables the system to track you and direct you to the lowest cost of care, meaning you don't get over-treatment, and you do receive all the treatment that you need. Again, you're hoping to keep things simple and not have complications further down the line. Now, if you talk to any of the big healthcare systems, they will tell you they expect, roughly in the future, say 10, 20 years from now, 2/3 of people will be electronically triaged and case managed. If you look across the globe today, it's probably more like 1 or 2%. So this is a market-leading company in a marketplace that's going to expand in size 50 or 60-fold.
But I think that's what people want as well, because you want the convenience of not having to talk to someone or not having to leave work early to go to the doctors. If you can do anything for an app or anything is... Well,
particularly for younger people, they always have an expectation that everything is available digitally, but it's managing that journey through. Human beings are incredibly unreliable and irrational when we make terrible choices about, if you decide if you've got a child and your child's sick and you can't get an appointment with your GP, you're going to go straight to the hospital, and the cost to the NHS if you go to A&E are like 3 or 4 times higher than if you went to your GP. So that's just an example of, if you can give people reassurance easily, or if they do actually really need to go to the hospital, you can tell them to go straight away, so that if it's a complicated thing, it gets addressed. That's the way that you avoid cost and at the same time also save costs where necessary in a simple and effective manner. So this is going to be absolutely the way the whole market goes, and Teladoc is the leader in terms of its global footprint, but also in terms of the way it's deployed this technology in the US market to date.
Well, thank you so much for your time.
Thank you.
And thanks for joining us.